All right, back here at ASAP's 2018 with Dr. Rappaport again. This time we're going to talk about something that not a lot of patients that may be dealing with this are aware of, something I've never heard of, but something that's really important. It's called breast animation deformities, right?
Correct.
Cool, so tell us about it.
Thanks, Drew.
Yeah.
So animation deformities of the breast are a result of muscle, the chest muscles, compressing a breast implant, and when the muscle contracts, it distorts the position of the breast.
Okay.
So this can occur in some people that have had a breast augmentation, but more frequently occur in people that have had breast reconstruction using breast implants.
So muscle contraction, talk to me about that. Like that's like actually like when you're moving pectoral muscles type?
Correct.
Okay,
these are the pectoral muscles, and the reason that the implants are placed under the muscle is basically to blunt, if you will, the shape of the breast implant so that edges are not seen.
Okay.
So the reason that it is less common in women with breast augmentation than with breast reconstruction is that there's less padding, if you will, between the skin and the underlying muscle for somebody that's already had a mastectomy or their breast removed.
Okay. Why? So why don't so many patients know about this, even if they're dealing with this? Is it a subtle change, subtle movement to the side?
For the most part, it is subtle.
Okay.
Even people that have not had breast implants, if they're bodybuilders or work out vigorously, that when the chest muscle moves, the breast will move to a certain extent.
Okay.
So what happens is that it's actually magnified, if you will, with people that have implants.
Okay.
It probably occurs in most individuals that have it to some degree or the other, but only probably about 10% of people, let's say, that have had breast implant-based reconstruction would really be bothered by this in terms of the extreme of the visual, or perhaps even some discomfort with the muscle contracting.
Okay, gotcha. So you kind of hit on it there a little bit, but so tell me, if I'm the patient who's dealing with this, what are some indications? How would I know, and what should I do next?
Well, this problem has been around for a while.
Okay.
And there have been multiple attempts in terms of trying to minimize the effect, from trying to cut the nerves to the muscles to even using Botox.
Oh, wow.
And nothing has really been totally effective.
So Botox, that actually injecting Botox into the muscles?
It was an attempt, but obviously there's risk in terms of puncturing the breast implant at that point.
Right. Oh, wow,
and it's
of
also
course.
very difficult to necessarily find exactly where the nerve would be to be able to deal with this.
Gotcha.
So more recently, there's been attention paid to actually now removing the implant from behind the muscle, placing it on top of the muscle, using a skin substitute type of tissue over the implant, and then dealing with some fat grafting perhaps to the breast to give more fullness and minimize or alleviate that deformity.
Okay, gotcha. So if you're a patient and you're dealing with this, you can come see you or another plastic surgeon, and there is a solution. They may move the breast from underneath to the top, and it's kind of like a breast reconstruction or a breast revision, I guess you would call it, right?
It's a revisionary. It's a revisionary surgery. Clearly, there is a movement in that direction. But again, it becomes a staged procedure because most of these procedures most of the technique in placing the implant in front of the muscle with the skin substitute will require some type of fat grafting to minimize the amount of visual disturbance to the implant.
Yeah. Okay, cool. So what about, is there any silicone, saline implants? Does it matter? Does this happen to everybody no matter what type of implant it is, or is there?
Yeah, I don't believe that it really is a matter of what type of implant. And again, purpose of putting the implant under the muscle is to try to avoid visual signs of rippling, reduced capsular contraction, which is scar tissue that can form, and basically has been the standard for a long time. Basically, we're now trying to address some of the issues that were a result of that procedure in a small number of cases, but now we may have a better answer to fixing it.
Okay, I like it. So last question. This wouldn't necessarily be something that a doctor did wrong, right? If you did a breast augmentation or reconstruction, it wouldn't. This is just something that can happen, right?
This is not a cause and effect based on the physician.
Yeah. Okay.
It's basically a patient's body, their reaction, their animation, and their body contour.
So while I have you here, I want to ask you a question about a facelift patient. So if you're considering a facelift, how do you know what to expect? If you're going to have the procedure, what should you expect?
My quick tip for a person that's having this after the consultation is to have them lie back in the examining chair or examining table, hand them a mirror, and allow them to see the effect of gravity, which is what a facelift does.
Gotcha. And so you actually have the patient lay down on the examining table, you give them a mirror, like a handheld mirror, and they just...
Correct.
Okay.
They're lying down.
Okay.
Facelifting is an anti-gravity procedure. The tissues fall back into position.
Okay.
And we say this is what we would like to achieve, a very soft, natural appearance.
Yeah. Beautiful. I love it. Awesome. Well, thanks once again.